My name is Jennnifer Hollington, and I've been treated for multiple cancers at the Ottawa Hospital. So in July 2020, I woke up in the middle of the night with a pain in my abdomen about where my gallbladder would be. After an abdominal ultrasound and some blood work, the ER doctor called me into a small room and told me that I had ovarian cancer. So I was scheduled for surgery. At the end of August, I had surgery to remove the cancer, as much of it as possible. And then a few weeks after that, I started chemotherapy, the first of 6 rounds here at the Cancer Center. One of the first places you come to when you're about to start chemotherapy is this reception area, and you're welcomed here by a friendly face. You don't know what to expect, you don't know where to go. They get you settled, they get you feeling okay, and then you get taken in by one of the lovely nurses to the chemotherapy area and start treatment. After the surgery, my tissues were sent for pathology, and the pathology report showed that I had a mutation in my breast cancer 2 gene, or BRCA2 gene. I wanted to avoid having another cancer, having just come through one cancer and having had treatment for that cancer, and knowing that the effects of cancer treatment such as chemotherapy are cumulative. I opted for to have a preventative bilateral mastectomy. Before I could get to the breast cancer risk reduction surgery, I continued to go to my family doctor, and I had an issue that had persisted for a few years. It was a little itchy patch of skin near my anus. I talked to my family doctor about it. She referred me to a dermatologist. He believed it was precancerous. When I went through the surgery, which was done again here at the Ottawa Hospital, the pathology report revealed that it was cancerous and that there was precancerous cells that remained in the margins. So I was referred for radiation treatment and was told that with that treatment, my chance of being cured of that particular cancer was 85% or better, and so those are pretty good odds in my view, so I decided to go through radiation treatment as well. I have been the beneficiary of past research, past medical interventions, and past participation of patients in things like clinical trials. It's so important that we invest in research, in clinical care, in knowledge, and I hope that through my story I can benefit others, and through interventions that have been used for me might have given the Ottawa Hospital and other research organizations the kind of information that will make treatment better in the future for others who have cancer, and specifically ovarian cancer. One of the things I've tried to communicate in sharing my story is that it's possible to experience joy while you're going through cancer treatment, not simply when you finish cancer treatment. Being back here in the Cancer Center, it's rather emotional for me, remembering some of the incredible nurses who administered chemotherapy. We have such tremendous staff who work in the Ottawa Hospital and who really care about the patients they serve. So I was the beneficiary of that, and I feel very lucky to have the Ottawa Hospital in my community, and it brings back a lot of really positive memories for me coming back to the Cancer Centre today.